Pre-medical coding, CPC, SDS, Ambs prep session 24, digestive system coding. So as I told you previously, I will not show the CPT book with you. So you need to use your CPT book to find the answer. So why means in CPC exam, as I told you, if you are familiar with your CPC book, you can get answers easily and you can save your time. So like you can have time management skills if you use your CPC books continuously. So as usual, so we are going to start first question of the day. So here is the question. So now it is 9:32. We will discuss the answer at 9:36. So whenever you find the code, just to see the section. So where is this code located? Why means we have incisions, excision, distractions like that. So for example, physician performs distraction. But if the physician, in CPC exam, if you find incision code, you can directly eliminate incision code. Like that, you need to check the heading of that particular code section. So today's most of the questions are useful while doing the live coding also. Live coding also, you will get the same Q&A. Like, so if anyone finishes, just mention the answer here. So don't worry, anyway, today is Saturday. If you have any doubts, we will discuss at the end. Our first priority must be learning CPC. So after that, remaining things. So you need to be familiar with all your CPT book, then only you can write properly. Yeah, thank you guys. Anyway, as I told you, these are little bit easy only. So you can do easily. So you need to prioritize while writing for CPC exam. So what are the chapters difficult for me? What are the chapters easy for me? So wherever you are easy, need to do more concentrate on those chapters, but 100% you need to give attention to that chapter. So okay guys, time over now. So we will discuss here. A 38-year-old patient is admitted to the hospital for chronic cholecystectomy. So try to remember this procedure is very common while coding live, what do you call, same day surgery coding also. So these are very, very, very common procedure. So chronic cholecystitis. So cystitis means inflammation. So cholecysto means gallbladder. So it is like inflammation of gallbladder, for which a laparoscopic cholecystectomy. Okay. So but physician will give laparoscopic cholecystectomy here. But if you go down, they will perform open cholecystectomy. So in order to remove that problem, we need to read whole operative report. So a transverse infraumbilical incision was made, sharply dissecting the subcutaneous tissue down to the fascia using access under direct vision with a vesiport. So this is the keyword here, and a scope was placed into the abdomen. Okay, three other ports were inserted. So these are also one keyword under direct vision. The fundus of the gallbladder was grasped through the lateral port, where multiple adhesions to the gallbladder were taken down sharply and bluntly. So in CPT, whenever you find lice of adhesions, all these words, you no need to code separate code for lice of adhesions taken down sharply and bluntly. The gallbladder appeared chronically inflamed. So already they have mentioned here cholecystitis, and here also they are mentioning it is chronically inflamed. So it is basically inflammation of the gallbladder. So dissection was carried out to the right of this, identifying a small cystic duct, and artery was clipped twice proximally, once distally and transected. So here cystic duct also transected. The gallbladder was then taken down from the bed using electrocautery, delivering into the endo bag. So this endo bag will be used exclusively in laparoscopic surgery only. So endoscopic bag, and removing it from the abdominal cavity with umbilical port. So if we check this operative report, physician has performed complete procedure using the port. See here, he is mentioning endo bag and removing it from the abdominal cavity with the umbilical port. What CPT code is reported? So directly, as I told you before, you need to check the heading of this code. For example, if you take 476 series code, these are excision, but those are open procedures. So we need to eliminate these two codes directly. So without wasting your time. So that's why I am not showing CPT book. If you see the CPT book, you can remember easily. So as ours is laparoscopic procedure, directly we will eliminate these two codes C and D, and we are left with A and B. So A is for laparoscopic cholecystectomy with common bile duct exploration. So but here physician did not do any exploration of common bile duct. So physician performed here only laparoscopic cholecystectomy. So here our answer is 47562. I hope everyone got this answer and few people write correct answer. So nothing else. Whenever you see operate report, you need to check whether it is open procedure or laparoscopic procedure. But if you see in the initial lines, you know need to confirm using the initial lines. You need to find the keywords like this. If you see here, these all are the keywords. So you need to identify whatever the operative report you can see. So these are all keywords you need to identify and you need to confirm your code. So good guys, good Gaurav, Parimala, Vidya, Sarika, you are doing good. So today's second question of the day. Yeah, go ahead and write this one. So try to use your CPT book. Even I am also using my physical CPT book here. So remaining guys, you need to worry about the answer. If you want to learn, you need to answer. So if you do practically only, you can get good understanding of book navigation. So we will discuss answer at 9:45. So these hernia are also hernia coding also one of the most common procedures in same day surgery coding. So today's session is very useful for the people who are planning to do in ambulatory surgery coding. So these are our common procedures. So if you follow my guidelines, you can pass very easily. Thank you, Gaurav. Yeah, all are doing good job. Gaurav and Parmila, you don't need to worry, and Vidya also, you are doing good. So yeah, exactly. Yeah, exactly. I got it. So anyway, while live coding, we are also doing 2023, but anyway, you know that these are deleted so that you can give more like precautions while coding these procedures. Yeah, yeah, I know Vidya, as this is the old paper, so I have provided this. So I know these codes are deleted. Even we are not using while coding live. So we need to concentrate more on the how to find the correct answer, whether it is deleted or not. Anyway, it is deleted only 100% deleted code. Yeah, yeah, correct. So we will discuss our answer. So anyway, it is a deleted code. So we will discuss and we will try to find the keywords here. A 58-year-old female who has a history of symptomatic ventral. Yeah, no problem, Mamta. Symptomatic ventral hernia. So patient has ventral hernia. Was advised to undergo laparoscopic evaluation and repair. So basically, hernia repair comes under or herniorrhaphy. All the codes are same. An incision was made in the epigastrium and dissection was carried down through the subcutaneous tissue to 5 mm trocars. So trocars are the keywords. One in the left upper quadrant and one in the left lower quadrant, and the laparoscope was inserted. Dissection was carried down to the area of the hernia where a small defect was clearly visualized. there was some momentum which was adhered to the hernia and this was delivered back to the peritoneal cavity. The mesh was tacked on to cover the defects. What procedure code is reported? So if you see this code, if you are familiar with your CPT book, you got to know that 49560 is for open procedure. But based on our report, physician has performed laparoscopic procedure. So directly we will eliminate A 49560. So we will check 49652. What is 49652? So these 496 series maximum course comes under laparoscopy. What is 49652? Laparoscopy, surgical repair ventral umbilical spigelian or epigastric hernia includes mesh insertion when performed reducible and 49653 incarcerated or strangulated. So based on our operative report, it is not incarcerated or strangulated hernia. So we can eliminate C. And also based on laparoscopy section guidelines, mesh or code guidelines also, mesh insertion is included in the hernia repair code. So D is also wrong. Why means 49568 is included in 49652. So here our answer is 49652. I hope everyone got this one. In a way it is deleted code, but as we are using previous papers, I have added this one also in order to know that you guys know that we have deleted codes in hernia repair. Anyway, most of the people do done well, no worries. So third question of the day today. So I think I need to, yeah, see from here. Oh, sorry, 1 second. Yeah, now you can check. So whatever it is the question, you are in a position to understand the keywords and finding the correct code. So as I told you, just you need to check the headings and find. If you know proper headings, you can save your time. So it is like one type of time management skill. If you are familiar with your CPT book. So as I told you, today's questions all are easy only, not that much difficult. Good evening, Divya. Yeah. So that's why whatever you feel are easy, you need to concentrate more on those. For example, if you feel few chapters are very difficult, don't spend more time on that. Even CPC exam also like that only. If you feel one question is very difficult, don't spend more time on that question. Directly go to next question. That is one type of CPC strategy. Yeah, anyway, we got our answer. So we will discuss without wasting our time. So here also same guys, same way. Your patient has acute appendicitis. So basically it is like inflammation of appendix with possible rupture. So in CPT, we have codes for normal appendicitis and ruptured appendix. So we need to take precautions while coding appendectomy here. physician is mentioning possible. So this is not confirmed. So we will not quote rupture code. We will use only normal appendectomy code. So he has been brought to the operating room and infraumbilical incision was made, which was Verastep trocar. So here it is enough for us to quote laparoscopy procedure. Here also laparoscope was introduced. A second 5 mm trocar was placed. These are all are keyword, and here also physician has used trocar. A window was made in the mesoappendix using blunt section with no rupture noted. The base of the see here. That's why here possible rupture mentioned. So in operative report, physician is confirming there is no rupture. So we can't code rupture code here. The base of the appendix was then divided and placed on the endo cache bag. So here also only endoscopic procedures physician will use this endo catch bag, and the 12 defect was brought out. Select the appropriate code for this procedure. So what are the codes here? We will check 44950. What is that? 44950. Yeah, easy only basically. Digestive system. So so 44950 is appendectomy, but it is open procedure. Why means it is under excision. So excision only, but it is a open procedure. So directly we can eliminate 44950, and we can eliminate 44960 also, which is for ruptured appendix. So you need to remember here that 50 and 60 are open procedure. So we can't code open procedures as physician has performed the laparoscopic procedure. So we are left with two codes A and D. So we will check 44970. So 44970 is laparoscopy surgical appendectomy. That is the correct code. And 44979 is for unlisted laparoscopic procedure appendix. But we have code for laparoscopic appendectomy. So here our answer is 44970. So Gaurav, you got this na time management skills. So if you are familiar with your CPT book, so you can save your time very easily. So if you are writing CPC exam, most of the time use your CPC book. Sorry, CPT book. Yeah, go ahead and complete this one. The time is 9:55. We will start the session at sorry. We will discuss the answer at 9:59 or 10 based on the replies. Thank you guys. Thanks for your like buttons. Thank you very much. If anyone forgot to click on like button, please click now. So this motivation only helping me to continue these live sessions. I think June 1st onwards, I am planning to start live SDH chat, same day surgery coding chat training, but that is not free. That is for paid training. So anyway, I will mention in our groups. So there you will get good idea about how to do live scenarios while doing ambulatory surgery coding. I will explain in step by step while teaching live reports. Thank you guys. Thank you very much. So, so you got to know that digestive system is little bit easy. So you need to concentrate more on digestive system. So for example, if you have five question and answers in digestive system, you need to concentrate more on them. So that damn sure you will get those 4 or 5 marks. So anyway, Sarika, Sarika needs your answer. So Mamata does not have any CPT book with her. So no worries. So okay. Okay, thank you guys. We will discuss our answer here. So we will check now. We will check first 44005. So what happened here actually? A 75-year-old female had a CAT scan which revealed evidence of proximal small bowel obstruction. Okay. She was taken to the operating room where an elliptical abdominal incision. So mostly open procedure, you need to find the keyword incision. So physician will use incisions mostly for open procedures. And in laparoscopic procedures also physician will insert or create small incisions, but they will not come under open procedure. What happens in open procedures? Physician will perform complete surgery in open only. So incision was made excising the skin and subcutaneous tissue. There were extensive adhesions along the entire length of the small bowel. The omentum and bowel were stuck up to the anterior abdominal wall. Time consuming. So these are the keywords here. Spending an extra hour to lyse up adhesions to free up the entire length of gastrointestinal tract from the ligament to traits to the ileocolic anastomosis. So we need to find the correct answer here. So here physical physician basically perform lysis of adhesions. So we need to find the code for that. So as usual, first we need to check the code category. So if we check 44005, what is that? So 44005 is intestine incision enterolysis. So it is not enterolysis, adhesion of lysis of adhesions. So this is not correct. We will eliminate 4405 and we are left with, so, and we will check 44180. What is 44180? If you check 44 series, it will comes under laparoscopic procedure. So, but here physician has performed only open procedure. So, directly we can eliminate B and D, and we are left with A and C. So, basically, what is 44005? It is enterolysis, freeing up intestinal adhesions. So, basically, it is entero means intestine, lysis means like release of adhesion. So, here physician has performed lysis of adhesions. See here, this is the keyword. So, as physician has mentioned, time consuming, tedious and spending an extra hour to lyse the adhesions, we need to add 22 modifier for 44005. So, here our answer is C. We have added 22 as physician mentions for lyse of adhesions. Physician spent more time and it is tedious and spending an extra hour. Because of that reason, we need to add 22 modifier. So you need to check the keyword. For example, in the document, if you find time consuming, tedious and spending an extra hour, directly you can add 22 modifier. So because of that reason, we need to add 22. Here A is wrong. So our answer is C. Yeah, most of the people don't. Correct answer only. Got it. Good guys. Keep it up. So just you need to find the keywords time consuming, tedious, and spending an extra hour. And sometimes you may find extensive also. Like physician will mention extensive list of adhesions also. So if you see extensive also, you need to code 22 modifier. But basically, when do you code these list of adhesions? If it is the only procedure, you can code 44005. So if list of adhesions is performed with any other major procedure, you can't code 44005 as it is a separate procedure. You can't code 44005 with major procedures. Got it, guys? Yeah, no worries. Today, most of the people are doing good. Good job, guys. So, today's fifth question. So, now time is 10:04. We will discuss the answer at 10:08. So, just follow your CPT book. So, you see now, using our CPT book only, we are saving our time. Even our session is also moving very fast. Even in live coding also, if you have CPT book with you, you can code very easily. So even now also, I will use my CPT book while coding in live. Yeah, Okay, Mamta, done. So tomorrow we'll do modifiers. No worries. I need to check the document if I have document or not. If I have the modifier document, we will do modifiers. Otherwise, you need to wait for next week. So this fifth question is bit confusing. So anyway, if you know the basics, you can code easily. Yeah, sure, Sarika. I will plan. Yeah, sure, Gaurav. We will do now that. So it is basically so a 35-year-old patient was admitted with massive gastric dilation. So it is basically dilation of stomach. Gastric means stomach. So the endoscope. So endoscope is the keyword here. So this is endoscope was inserted with a catheter placement. Okay, keywords. The endoscope is passed through the cricopharyngeal muscle area without difficulty. Okay, esophagus is normal. Some chronic reflex changes at the esophagogastric junction noted. Okay, stomach significant distension with what appears to be multiple encapsulated tablets in the stomach. At least 20 to 30 of these are noted. Okay, some of these are partially dissolved. So basically, patient has consumed few tablets. So endoscope could not be engaged due to high-grade narrowing in the pyloric channel. The duodenum was not examined. Here it is the most important keyword here. So it seems to be high-grade outlet obstruction with a superimposed volvulus. So a repeat examination is not planned at this time. What code should be used for this procedure? So first we will check 43191. So 43191 is what is that? It is esophagoscopy. So basically it is not an esophagoscopy. Why means here physician has crossed the esophagus and he entered to esophagogastric junction. So directly we will eliminate 43191. So we will check 43235. 43235 is EGD diagnostic. So here it is not a diagnostic procedure. Here physician has performed the catheter placement also. So we will eliminate 43235 also. So we are left with A and B, 43241 and 43246. We need to check those answers. So what is 43241? So what is 43241 is EGD with insertion of intraluminal tube or catheter. What is 46? So 43246 is with directed placement of percutaneous gastrostomy tube. So here physician did not inserted any gastrostomy tube. So basically gastrostomy means it is like artificial opening. So physician did not do any artificial, created any artificial opening. So we will eliminate A also here. So basically 432, 46 is for EGD with gastrostomy creation. So which is not occurred in our question. So we are left with 432, 41, 52 as physician has not went until the complete duodenum. So physician has stopped at some place. So we need CPT guidelines. We need to code 52 modifier like reduced service if physician did not perform procedure completely. See here, endoscope could not be engaged due to high grade narrowing in the pyloric channel. So the duodenum was not examined. So in normal EGD, physician has to examine complete duodenum. But in this question, physician has mentioned that duodenum was not examined. So we will consider it as a reduced service and we need to append 52 modifier for 43241. So basically 46 is for gastrostomy creation, 41 is for this one, EGD with catheter placement. So Gaurav, you got this one? You got difference, na? If you said okay, we will continue. Gaurav, any confusion now? 46 is for gastrostomy tube insertion. Okay. 41 is for catheter placement. So, yeah, that's why Gaurav, we need to read the code description completely. So if you check 43246, it is directly mentioning directed placement of percutaneous gastrostomy tube. So if the physician performs gastrostomy, they will mention in the document, I have performed gastrostomy tube, like gastrostomy placement or creation of gastrostomy. It is like a artificial opening. Yeah, yeah, gastrostomy tube is for like feeding purpose only. Yeah, correct. Yeah, you are correct, Sarika. So basically, any type of ostomies are used for the feedings or elimination. For example, if you see colostomy, so you know that using the colostomy tube, you can't feed. If the patient has absence of rectum or anus, physician will create colostomy, and using the colostomy, physician will eliminate the feces. So all the ostomies are not for feeding. So we have ostomies for elimination also. But in this scenario, 4 6 is for gastrostomy creation, that is used for the feeding. That's correct, Sarika. So today's sixth question. Go ahead. So now it is 10:15. We will discuss the answer at 10:19 based on the replies. So encourage your friends to subscribe to our channel, guys. So it will be more useful for them also. So even our sessions are very useful for same day surgery coding students also. So maximum if you are writing CPC or ambulatory surgery coding, try to use your CPT books. So if you are perfect with your CPT book, you will save your time most in the CPC exam. So using modifiers also, you can get damn sure answers in CPC exam. So next week we will plan modified topics. So whenever you write the answer, we need to remember that why is that answer is correct. So in that way, we need to research. So if you research properly, that understanding useful for remaining or other question and answers. So we have 2 more minutes. Most of the CPC questions are options are very same with minor changes. Hi Divya, are you from Vizag or Hyderabad? Divya Paladugu. I know one girl named with Divya Paladugu like that. So that's why I'm asking if I know you previously. Okay, okay, Tirupati. Okay, okay, cool. So I means previously I worked with Divya Paladugu. I think your both names are correct. Same. But even her name is also Divya Paladugu. So anyway, no worries. We will discuss our sixth answer today. So the patient is a 48-year-old white female with morbid obesity that presented with small bowel obstruction. So as all of us know, we have small bowel and large bowels. So basically our colon comes under large bowel, remaining gas like ileum, jejunum, all this comes under small intestine. So small intestine or small bowel, both are same. So she had surgery approximately 1 week ago and underwent exploration, which required small bowel resection of the terminal ileum and anastomosis, leaving her with a large inferior ventral hernia. Okay, so here we need to understand that physician had surgery 1 week ago and she underwent exploration. Due to that exploration, she has small bowel resection. Okay. 2 days ago, she started having drainage from her wound, which has become more serious. So, 1 week ago, she has completed her surgery, but 2 days ago, patient started having drainage from her wound, which has become more serious. Okay, she is now being taken to the operating room. Okay, fine. Reopening the original incision with a scalpel, the intestine was examined and the anastomosis was reopened, excised at both ends, and further excision of intestine. Okay. The fresh ends were created to perform another end-to-end anastomosis. So we got to know that anastomosis means joining up two parts like tubular structures. Mostly anastomosis is used for tubular structures. So like we can check. So basically here what happened? Patient has undergone exploration and also small bowel resection 1 week ago. But 2 days ago she has started having drainage from her wound. So physician has taken her to the operating room again, and he has opened the incision and he has performed again the procedure and created anastomosis. So we need to remember that here it is a open procedure. So there is no port or any keywords related to laparoscopy is mentioned here. So we will check 44202 first. So what is 44202? 44202 is for laparoscopy. So directly we can eliminate 44202 as it is a laparoscopic procedure. But based on our operative report, we had patient had underwent open procedure. Directly we can eliminate 44202. So we will go ahead and check 44120. So what is 44120? Enterectomy, resection of small intestine, single resection and anastomosis. And also 126, enterectomy, resection of small intestine for congenital atresia. So basically 44126 is for congenital atresia, which is not mentioned in our document. So we are left with option A and option C. So here we need to use option A as it is a unplanned return to the operating room. So here our answer is A. So as it is a unplanned return to the operating room, we need to use 78 modifier to our CPT code. Yeah, I think most of the guys wrote correct answer. Yeah, good guys, keep it up. Yeah, go ahead. So now we will learn seventh question of the day. So 1 second, I will make it less so that you can see the codes also. Otherwise, I will do one thing like this. So this is very big operative report. That is the problem here. So can you see guys now? Yeah. See here after 2 minutes. So here diverticulitis, perforated diverticular procedure is Hartmann procedure, which is a sigmoid resection with Hartmann pouch and colostomy. So you need to find answers for this. So here are the options. Just try to remember the procedure, Hartmann procedure, which is a sigmoid resection with Hartmann pouch and colostomy. And these are the options. So now it is 10:26. We will discuss the answer at 10:30. So, and also inform your friends about our channel. Yeah, that is correct, Salma. But basically, our sessions are useful for both CPC as well as SDS coders. So, we are using both approaches. But anyway, if you modify also, you need to know the operative report first. So, what happened inside the operative report? So, if anyone watches our sessions, both are useful for SDS coders as well as the CPC aspirants. So, anyway, it is not a bad suggestion, it is good suggestion only. Thank you, Salma. Thank you very much for your keyword or suggestion. Yeah, even if you want to use the modifier also, you need to know the operative report first. Then only you can understand. So you are left with 1 more minute. Okay, guys, we will start our keywords finding. So patient has diverticulitis, perforated diverticula. So basically, it is inflammation of diverticulum. So here procedure is Hartmann procedure, which is a sigmoid resection with Hartmann pouch and colostomy. So we need to use. So first of all, in this report, we need to find whether it is open procedure or laparoscopic procedure. In order to find that, so we need to check first few codes. So here it is mentioned as open procedure. See here, physician has created the incision. So directly we will eliminate first 44208. So as it is for laparoscopic procedure, but physician has performed here open procedure. So we will eliminate 44208. So now we will check 44140. See here the sigmoid colon or the colostomy site was sutured inside using. So physician has performed the colostomy also here. We will check 44140. So what is 44140? Colectomy partial with anastomosis. So which is not performed here. So basically here physician has created colostomy, not colectomy. So 44140 is also wrong. We will check 44160. Colectomy partial with removal of terminal ileum with ileocolostomy. Here physician has performed only colostomy, not ileocolostomy. So we will eliminate 44160 also. We are left with 44143. See here, directly you can find this answer. Hartmann type procedure with end colostomy and closure of distal segment. So as I told you in previous classes, using the surgery procedure also, like Hartmann is a surgeon name. Using his name, they have created Hartmann type procedure. So if you check your CPT index, you can find Hartmann procedure. Using that also, you can find the answer. So here our answer is B, option B, which is 44143. It is a direct question. Using these questions, you can save your time. So question number 8. Now the time is 22:33. We will discuss answer at 22:36. So this is also easy only. Thank you, Vidya. So we have 1 more minute. Thank you, Sarika. Yeah, thank you, Divya. So we will discuss our answer. So the patient is going into the OR for an appendectomy with ruptured appendicitis. So these are the keywords here. Right lower quadrant transverse incision was made upon entry to the abdomen. In the right lower quadrant, there was a large amount of pus consistent with right lower quadrant abscess. Okay, patient had abscess along with ruptured appendix. Intraoperative cultures, anaerobic and aerobic were taken and sent to microbiology for evaluation. Okay, irrigation of the pus was performed until clear. The base of the appendix, right at the margin of the cecum, was perforated. The mesoappendix was taken down and tied using girovacral ties, and the appendix fell off completely since it was already ruptured with tissue paper thin membrane at the base. So there was no appendiceal stump to close or to tie, just an opening into the cecum. Therefore, the appendiceal opening area into the cecum was tied twice using figure of 8 vicryl suture. Momentum flap was stuck over this area and anchored in place using interrupted 3O vicryl sutures to secure the repairs. So basically, physician has performed here open appendectomy as there is no keywords like any port is not mentioned in the document or in this scenario. So directly we will eliminate 44970. Okay. Now we will check 44950. So what is 44950? 950 is appendectomy, normal appendectomy, open appendectomy. 960 is for ruptured appendix with abscess or generalized peritonitis. So based on our documentation, patient had ruptured appendicitis. So we need to choose 44960. So B is the answer here. 950 is for normal appendix or normal appendectomy, and 960 is for ruptured appendix with abscess. If you see here, we have keywords also. Patient had abscess also. See, quadrant abscess. So here our answer is 44960. And one more keyword is for add-on codes, we can't use 51 modifier. So we can eliminate C also. Our answer is B, 44960 49905. So last question of the day. Now it is 10:13. Sorry, 10:39. We will discuss the answer at 10:42. So Parimala, what happened to you? You are not providing answers. Are you here with us? So you have 2 more minutes. Yeah, thank you, Sarika. So, okay, we will discuss our answer now. So, a 15-year-old female is to have a tonsillectomy. So, basically, tonsillectomy means removal of tonsil performed for chronic tonsillitis and hypertrophied tonsil. So, basically, inflammation of the tonsils, as well as because of that inflammation, patient has hypertrophied tonsils. Hypertrophy means the tonsil size will increase. So a McClever mouth gag was put in place and the tongue was depressed. Okay. The nasopharynx was digitalized. Okay. No significant tissue was felt. The tonsils were then removed bilaterally by dissection. Okay, cool. The uvula was also huge size because of edema. A part of this was removed. Okay. And the raw surface oversoon with chromic catgut, which CPT codes are reported. So first we need to check 42842. So what is 42842? 42842 for radical resection of tonsil, tonsillar pillars and the retromolar trigone without closure. So this is directly wrong. So we can eliminate 42842 as there is no resection of trigone occurred. So we will check 42821. Next A. So 21 is for tonsillectomy and adenoidectomy. So while coding tonsillectomy, we have combination codes for tonsillectomy and adenoidectomy, and also we have separate codes for only tonsils and only adenoids. So in our procedure, physician has performed only tonsillectomy. So we need to concentrate more on only tonsillectomy. So our answer option A is wrong. Why? A is for adenoidectomy plus tonsillectomy. So next we will check 48, 25 and 26. So what is 25? Tonsillectomy, primary or secondary younger than age 12 and 26 age 12 or over. So as our patient's age is 15 years, we need to select 42826. So this is the correct answer. If you know this answer, you don't need to check 42106, which is for excision of uvula. So our answer is C here. We will check 42106 also. What is that? 42106. Yeah, with simple primary closure. Excision lesion of palate uvula with simple primary closure. So 42106 for removal of uvula. So I hope this session is very useful for you. So now it is 10:45. I will wait for 5 more minutes. So if you have any doubt, so you can mention in the comment section. We will discuss and we will conclude this session. So tomorrow mostly we will plan pathology. So few people are asking for pathology. So if you have any concern, please mention in the comment section. We will discuss for few minutes. Then we will disperse and we will meet tomorrow. I will wait for 4 more minutes. So if you have any doubt, we will continue. But if you don't have any doubt, we will disperse. So you have 3 more minutes. So and also encourage your friends to subscribe to our channel and learn free medical coding. Our channel contains videos related to inpatient, outpatient, SCC, E&M, denial management, anesthesia coding, dental coding. So encourage your friends to subscribe to our channel. Yeah, good night, Sarika. We'll meet tomorrow. So I will wait for 2 more minutes. Thank you guys. Thanks for attending this session. So who else? Yugender, Sarika, and Ramya, Mamta, Parimala, Vidya, Sandhya, Harinath, Gaurav, Shekhar, Mamta. So thank you guys. Thanks for spending your valuable time with us. Yeah, yeah, same time Vidya, 9:15. So if you are in our WhatsApp group, I will mention in the WhatsApp group also. No need to worry about that. I think you all guys are in our WhatsApp groups. So anyone need WhatsApp group? So we have 1 more minute. Yeah, tomorrow also same time, Vidya. So good night, guys. Happy coding. We will meet again tomorrow. Bye. Take care, guys.